each country in the world, by and large, has some traditional practice of their own. A lot of those practices don't have the kind of documented sources, texts, pharmacology, pharmacognosy, anatomy, the details of medical properties of herbs and so on and so forth, so well documented with rules, logics, protocols to follow that Ayurveda does. And that's what differentiates it from any normal traditional practice. So today we'll just quickly run through about Ayurveda, the source texts of Ayurveda, the fundamental concepts in Ayurveda. So first of all, we'll set the context of Ayurveda. What is Ayurveda today? How has it evolved? Then we'll talk about relevance of it, whether it is relevant today. You know, the world has advanced. We've seen advancements happen in health technology. Where does Ayurveda stand and what role can Ayurveda play? The framework of Ayurveda that renders it unique to today's times. And then we'll talk about applications and the way forward. Applications more from the point of view of what makes Ayurveda relevant to us, important to us, renders usefulness to us. What is the Ayurveda context today? How many of you have used Ayurveda in your day-to-day lives? I'm sure all of us have, right? क्या समझते हैं आप आयुर्वेद के? कैसे यूज करा है आयुर्वेद, या क्या यूज करा है आयुर्वेद में? The spices that we use in our day-to-day lives, that's part of Ayurveda. Certain products which are carrying Ayurveda ingredients. So knowing your Ayurvedic Prakriti and basis that, managing your life and lifestyle.
So conscious use of vegetables, especially the leaves, herbs in day-to-day practices.
Wonderful. Great. So as a medicine for certain health conditions is what you've used. Wonderful. So I think it's an audience which has made deep use of Ayurveda like many Indian households have. Then what is the problem with it? If we are all using it, if we are all applying it, why are we having this session on what is the application and way forward? And why has Ayurveda lost the sheen or lost the importance and relevance that it probably once held? So quickly looking at the canvas over the last 100 years, what has happened? I call it the dark ages of Ayurveda. Yes, so Ayurveda has sort of gone through this dark age period where the practices of Ayurveda, the ecosystem of Ayurveda, the institutions of Ayurveda, Dr. Ram spoke about the different sampradayas in Ayurveda that existed. Most of them don't exist anymore. A lot of the texts of Ayurveda have been lost or eliminated or out of practice. That has severely impacted the body of knowledge, its practice, its upgradation, its usage. So that dark ages have sort of diminished the potency, the impact, the usage which Ayurveda or the adoption that Ayurveda had in the community. Also, as the modern education advent happened and modern medicine picked up relevance and prominence, the Ayurvedic physicians who were even getting trained in Ayurveda did not have many opportunities to go out. For the longest time, most Ayurveda graduates and practitioners would go out and practice modern medicine or practice a mixed pathy, which is Ayurveda, some Ayurveda and some allopathy. So the practice kind of got lost, it got mixed, it got diluted, adulterated. And Ayurveda developed this perception with the common user, saying कि हाँ कुछ तो है, नीम हकीम वैद्य जी के पास जाएंगे. It got that perception of being a lower science. तो एलोपैथी भी लुक एट, हाँ ये तो कुछ तो साइंस है, इसमें सब टेक्नोलॉजी लगा है, डायग्नोस्टिक्स लगा है, इतना रिसर्च हुआ है. आयुर्वेदा हाँ कुछ जड़ी बूटियां हैं, तेल है, इट्स अ लो साइंस. हमारे घर में भी है, हमारे मसालदानियों में है. It's a lower science. That's the perception generated. And very importantly, for the end user, it was the choice of last resort or no resort. तो हम जब प्रॉब्लम हुआ तो पहले मॉडर्न मेडिसिन डॉक्टर के पास गए, वहां पर ट्राई करा, कुछ होम रेमेडी ट्राई करा. जब कुछ नहीं हुआ, डॉक्टर ने बोला जी अभी कुछ नहीं हो पाएगा या आराम नहीं आया, तब हम बोलेंगे चलो वैद्य जी को भी दिखा लेते हैं. किसी ने बताया वो वैद्य जी बैठते हैं, उनका अच्छा होल्ड है इस बीमारी पर, आप जाकर दिखाओ. So most patients or most people approach Ayurveda as the ऑप्शन ऑफ लास्ट रिजॉर्ट और नो रिजॉर्ट, जब कुछ नहीं बचा तो आयुर्वेद भी ट्राई कर लेते हैं. For the longest time, we called it the alternative medicine. Modern medicine is about 250 years old, and for thousands of years before that, people were practicing medicine in one form or the other. If there is anything in the longer term frame, modern medicine came in as an alternate. But we were very happy to marginalize it as the alternative medicine. We viewed it like that. The government viewed it like that for the longest time, and thereby, as an outcome, there were no upgradation. There was no quality talent coming into the sector. And I'm talking for the bulk of the nation. Yes, there were pockets that had an unbroken chain of practice and still qualitative practicing were happening, but by and large. And what that resulted in was Ayurveda became lost somewhere, or it got diminished to some sort of घरेलू नुस्खे practice. Yeah, I will try something. If it doesn't work, I will always try with a pinch of doubt in my mind. कि हाँ ले लेते हैं, पता नहीं असर करेगा कि नहीं करेगा. However, we all see this. I mean, the reason why IKS is happening, all of you are here, we are talking about it, is there is a definite rise. There is a rise of people wanting Ayurveda, people wanting access to Ayurveda. We've seen this even with the patients who are approaching us for the treatment and in general. Why is that happening? One, globally, there is a trend, right? There is a trend towards natural, organic, back to the roots, safer options, safer alternates. As the trend grows globally, people are looking for natural options, safer options for their healthcare. Also, what somebody was mentioning here, for their beauty care, skin care. They want to look at products which are maybe natural in their outcome. On the back of that trend, Ayurveda has seen prominence. We have all seen that metabolic lifestyle disorders are growing very, very rapidly. I am sure you will have somebody in the family or in the immediate circle of yours who's got either diabetes or blood pressure or joint pain or eczema, psoriasis. They've become common. 25, 30 years ago, maybe they were not that common. Today, they are in every household. And because there is very little long-term impact that modern medicine is able to show in such disorders, people are looking out for options. And Ayurveda features as one of the options that they look out for. That's another thing, correct. The people are also starting to figure out that long-term usage of modern medicine leads to many, many, many side effects. So even if they're able to manage their sugar levels, eventually it starts impacting the kidneys, or it will start impacting the eyes, or their general body vitality. And thereby they want to choose options and look for other options. Obviously, as since the Ministry of Ayush has been set up, there is a specific focus on all Ayush systems. The International Day of Yoga being celebrated brings in a lot of focus. National Ayurveda is now being celebrated. Many things that the government is also doing at a national and international level is bringing focus to Ayurveda. And unfortunately, the world was hit with COVID. But one key learning that people came out with after going through the last 2.5, 3 years of the pandemic is one, only taking a pill is not a solution to health. And two, health is beyond disease. You need to build immunity, you need to take care of your health and not just wait for an accident to happen and then we'll see what to do. So COVID has sort of also changed the mindset of people towards how they look at health. And with Ayurveda gaining popularity and people wanting to access Ayurveda, it has given birth to another problem. What is the problem? There are many faces of Ayurveda. And I am sure I will go through one by one. Today you see around you, there is Ayurveda everywhere. There is the Chamatkari Ayurveda. You will go out and you will say कि हाँ 50 किलो वजन अभी कम करेंगे, आयुर्वेदिक जड़ी बूटी है, हमने तैयार करी है, हमने हिमालय की गुफा में जाकर अनुसंधान किया और 25 साल बाद ये रामबाण इलाज आया है, वो कैंसर भी ठीक कर देंगे, वो किडनी भी ठीक कर देंगे. तो चमत्कारी आयुर्वेद कि ये तो कुछ रामबाण इलाज है आयुर्वेद का. एक किट आयुर्वेद आया है कि हर चीज का किट है। आप मार्केट में बाजार में जाएंगे तो आपको नर्वस का किट मिल जाएगा, आपको किडनी का किट मिल जाएगा, आपको शुगर है शुगर का किट मिल जाएगा। इट इज ऑलमोस्ट लाइक आयुर्वेदा डिजीज केयर इज हैपनिंग ओवर द काउंटर इन द कंट्री, कि आपको आज डायबिटीज डिटेक्ट हुआ, आप जाइए डायबिटीज का किट खरीद के लाइए और ठीक हो जाएंगे आप। So there is a kit kind of Ayurveda which is coming in. There is another Ayurveda which is the Nuskha Ayurveda, the FMCG Ayurveda, which are the daily things हम जो घरों में करते हैं। हम काढ़ा पीते हैं, हमारे काढ़े के टैबलेट्स आए, कोविड में आयुष क्वाथ बहुत लोगों ने कंज्यूम करा है। FMCG products, तो all consumer products we use in day to day lives. आपका टूथपेस्ट हैं, सोप्स हैं, क्रीम्स, शैम्पू, हेयर ऑयल, अब आप तो आजकल अश्वगंधा चॉकलेट्स आ रहे हैं। सो ऑल दिस कंज्यूमर गुड्स आर ऑल्सो व्यूड एज आयुर्वेदा। देन ये नुक्कड़ आयुर्वेद है। आपके गली में कोई वेजी होंगे, उनकी दुकान है, वो पेशेंट भी देख रहे हैं, आप दवाई भी दे रहे हैं। देयर इज नेबरहुड आयुर्वेदा। देन देयर आर ऑल्सो टॉक्स ऑफ दिस साइंस बेस्ड आयुर्वेदा। कुछ कुछ लोग बात कर रहे हैं यार साइंस कहाँ पर है इसमें, एविडेंस क्या है, रिसर्च बेस्ड आयुर्वेदा, प्रैक्टिसिंग इट इन अ मोर क्लिनिकल फैशन। आप अगर बाहर जाएं, सर्च करें, देंगे लोगों से बात करें, तो यू विल सी अ difference that there are some people who are talking this language of how do we do evidence based ayurveda. There is also experiential ayurveda. Isko I say the mountain ayurveda or the beach ayurveda. So you go, you take a package and you go to the beaches of Goa or Kerala or in Rishikesh, and you go for relaxation, rejuvenation, where ayurveda kind of rejuvenates you. So there is an experiential ayurveda. There is the luxury ayurveda. There are brands that are coming out and telling you ये राजा महाराजाओं का आयुर्वेद है. These are exotic preparations. These are finely made preparations, organic and only for you. So there is a luxury ayurveda. And then there is new age ayurveda. If you see now, ayurveda is coming in all these funky fashions. You know, there are ayurveda dissolvable strips you put on your tongue and they'll dissolve. There is chocolate ayurveda coming. Uh, your cereals are being fortified with ayurvedic ingredients, and that's becoming ayurveda. This is new age ayurveda for the new age consumer. It's convenient, it's fast, it's easy. तो सवाल ये है कि आयुर्वेद है क्या? What is ayurveda? And whereas in modern medicine, it's a very clear cut imagery of the doctor, the pharmaceutical, the hospitals. Here, Ayurveda perception gets very, very different views. तो किसी के लिए वो सालदानी का डब्बा है, किसी के लिए वो दादी माँ के नुस्खे है, किसी के लिए वो सीरियस ट्रीटमेंट है कि हमारे को बीमारी होगा तो हम आयुर्वेदिक लेते हैं, किसी के लिए वो एक जीवन जीने का तरीका है, जीवन शैली है, जैसा मैम ने बोला कि हम अपना प्रकृति पता करें, उसके हिसाब से जिए. So what is the right frame of Ayurveda? And with Ayurveda gaining, it is also becoming consumer, the user is getting confused. वाकई में है क्या? ये क्रीम तेल शैम्पू आयुर्वेद है, ये प्राचीन ज्ञान जो मेरा कैंसर ठीक करेगा ये आयुर्वेद है, मेरे मसालदानी में जो हल्दी रखी है क्या वो आयुर्वेद है? आयुर्वेद है क्या? And if we want Ayurveda way forward, that clarity needs to come in, that what is Ayurveda. I leave Ayurveda there and talk a little bit about the health landscape. आज हेल्थ में, हेल्थ केयर में चल क्या रहा है? आयुर्वेद का रेलेवेंस है क्या? We have seen huge advancements in modern medicine. They have developed, they are talking about genetic sequencing, genetic modification. There is so much advancement that has happened, and with Ayurveda being suppressed for hundreds and hundreds of years, does it still hold relevance today? Obviously, today when we talk of medical science, पहला दिमाग में आपके आता है क्या? एक डॉक्टर जिसने व्हाइट कोट पहना है और उसने स्टेथोस्कोप लगा रखा है. That's the image of medical science. It comes in with white color, hospital, साफ, चमकता हुआ फ्लोर, या कुछ डायग्नोस्टिक इक्विपमेंट, या कोई आपका ब्लड निकाल रहा है और वो डायग्नोस्टिक हो रहा है. So modern medicine science, medical science is by and large equated to एलोपैथी और मॉडर्न ड्रग एंड फार्मा, ये पॉपुलर परसेप्शन है। ये परसेप्शन क्यों बना? व्हाई इज मेडिकल साइंस इज इक्वल टू एलोपैथी? ये आप ग्राफ देखें तो दिस लाइन शोज द वर्ल्ड ग्लोबल लाइफ एक्सपेक्टेंसी। तो पिछले 100 सालों में आप देखिएगा, तो अगर आप 1930 लें तो दिस वाज अप्रोक्सीमेटली 36-37 years global life expectancy at birth. Today that global life expectancy is 72. Modern medicine with its interventions has doubled the world life. पहले अगर average life expectancy at birth was 35, 36, 37, today it's 72. This is the biggest achievement of modern medicine. That's why when you say medical science, it comes as modern medicine. They've done such great contribution to the world. What is the space for Ayurveda? What is the relevance of Ayurveda? So there is a study, and same study, over the past approximately 60 years, the world has added 20 years to the life expectancy. तो पिछले 50 साल पहले, if average people were living 52 years, today they are living 72 years. However, the percentage of life lived less than average health is still 50%. So 50 years ago, half the life we were living in less than average health. Today, despite all the advancements, despite the access to healthcare, we are still living more than half of our lives in less than average health. So what does that mean? We have added years to the life, not life to the years. जिंदगी लंबी हो गई है, स्वस्थ नहीं हुई है. We are still 50%, and this is a research by published by the Global McKinsey Health Institute. This is not an Indian research. This is a global research. तो अगर ऐसा है तो आगे का क्या? This is global disease burden. अगले 20-25 साल में कौन सी बीमारियां बढ़ने वाली हैं? So there is an estimate that gets done every year. तो आप जरा पढ़ेंगे ऊपर, जो ऊपर है वो सबसे ज्यादा बढ़ने वाली है. हाँ, तो आप कोई भी पढ़े सबसे ऊपर. डायबिटीज, फिर न्यूरोलॉजिकल, विजन, कैंसर, मस्कुलोस्केलेटल, क्रॉनिक रेस्पिरेटरी डिजीज, ये वो बीमारियां जो ज्यादा बढ़ने वाली हैं. The global disease burden will increase in these areas over the next 20 to 30 years. ये सारी नॉन कम्युनिकेबल हैं. ये कोई बैक्टीरिया से नहीं होती है, ये कोई वायरस से नहीं होती है. These are all non-communicable lifestyle disorders. आपका कुछ लाइफस्टाइल में गड़बड़ हुआ है, that's why it has come to you. How prepared are we? So the same institute has also done a listing of how, given today's medical interventions, medical inventions, medical strength that we have, how prepared are we to handle these diseases? तो आप देखिएगा सबसे ऊपर जो रेड में है वो इन्फेक्शियस डिजीजेस हैं, तो व्हाइट बैकग्राउंड में है आर ऑल नॉन कम्युनिकेबल डिजीजेस. The lower that the disease is means we are not very well equipped to handle that disease burden. और ये जो सारा बीमारी है जो हमने देखा जो बढ़ने वाली है, कौन सा था? डायबिटीज. नेक्स्ट क्या था? कैंसर्स, स्किन, मस्कुलोस्केलेटल. Worse is mental health disorders. Now, given all of that one, despite all the advances, we added life, years to the life, not life to the years. diseases that are going to increase are the ones that we are currently least equipped to handle. यहां पर बीमारी बढ़ने वाला है, तो आप सोचिए आगे आगे क्या होगा. Does it mean we are going to spend more time in less than average health? Because disease burden that will grow will be growing, we will not be equipped to handle them. And thereby, what do we do? How do we work? And can Ayurveda play a role here? So, given that's the global health landscape, that's what the world is going through. The lower income countries are probably still struggling with the infectious diseases, but as soon as they've done with them, they're tackled with them, they are also facing an onset of non communicable diseases. India is well on its way to become the diabetic capital of the world. If I'm not wrong, I'm not sure, but if I'm not wrong, it is already the heart disease capital of the world. The number one reason for deaths is cardiovascular diseases. And it is happening at an early age, and it's going to increase. It's only going to increase. So, given that that's the framework, that's what's happening in the world of health at the moment, can Ayurveda play a role? How can Ayurveda play a role? So, I want to spend a little bit of time, although I think the three speakers before me have done a wonderful job at explaining what Ayurveda is, what the foundational principles of Ayurveda is. I am not an Ayurvedic doctor myself, so I will talk about it from a layperson's point of view. That having worked and seen Ayurveda and read Ayurveda, listened to people who are experts in Ayurveda, what do I make of the basic framework of Ayurveda that lends it uniqueness, that makes it unique. आयुर्वेद को हम बोलते हैं कि ये हमारी भारतीय धरोहर है और है, ये ट्रेडिशनल मेडिसिन है, वो है. But there is a difference between traditional practice and traditional science. प्रैक्टिस माने हम कुछ करते आ रहे हैं, और प्रैक्टिस का और साइंस का एक छोटा सा मैं आपको स्टोरी सुनाता हूँ. So there was a priest in our village temple, and he was very devoted, very devoted. He would every day by the clock wake up, do his things, do his routines, do all the deity service that he does. He would cook the meal, serve the meal, and everything. He started realizing that when he puts the meal as bhog, as offering, when he comes back after half an hour, the meal is gone. First, he got very happy. He got elated that God has taken my offering and he's eaten the food that I've given to him as offering, and he was joyful. He was ecstatic. And then happened the second day, the third day, the fourth day. And he started suspecting, there's something wrong. So one day, he put the offering to God and he hid behind the curtain, and he saw that a cat comes from the back door, eats all the food, and goes. And he said, "Oh my God, what aparadh have I done? What offense I have done? This cat is eating God's food." So next day, he would do the same routine, bath, prepare the meal, first go and tie the cat, then offer the food. And then nobody ate the meal. So the priest was happy. And this continued to happen every day. He will bath, prepare the food, tie the cat, and offer the food. One day, the priest died. So the priest's son takes charge. When he takes charge, he also dutifully follows the routine, gets up, baths, cooks the meal, ties the cat, offers, and it continued to happen. One day, the cat died. So the son is sitting and he is very, very upset. The village chief comes and says, "Why are you upset?" And he says, "From today, there will be no offerings to God." He said, "Why?" He said, "Because the cat died. And father never used to put offering without tying the cat. Now there is no cat. How do I complete the ritual? How do I complete my practice? There is no cat." So the chief was an intelligent man and he said, "Okay, I'll buy you a cat." So he bought him a cat And the offering continued. That's the difference between practice and science. When you do something practice, you may or may not know why you're doing it. There is no basis for it. There is no logic. There is no rationale. There is no explanation. There is no system that explains why it is happening or not happening. A science is when you are following a systematic way of working, when it is replicable, it is repeatable. And that's where Ayurveda differs from a lot of traditional practices. Each country in the world, by and large, has some traditional practice of their own. Africans have sangomas, South America has a very strong local practice. Native Americans have their own form of traditional practice. A lot of those practices don't have the kind of documented sources, texts, pharmacology, pharmacognosy, anatomy, the details of medical properties of herbs and so on and so forth, so well documented with rules, logics, protocols to follow that Ayurveda does. And that's what differentiates it from any normal traditional practice. That's traditional practice and traditional medicine. In the global framework, how do we operate, and can Ayurveda offer something to the global? Just to simplify, I may be oversimplifying, but modern medicine predominantly, and I'm calling it modern because it's recent from that point of view, it understands the human as an anatomical, clinical, physical understanding of what the body is, right? And that's why you see that Dr. Ram was mentioning in the morning that the first thing that is done is given a dead body and champion the body, understand it inside out. So the understanding of the human is a very anatomical, clinical, physical understanding of the human body. And it's a more philosophical debate. We can get into that later. It follows a reductionist system, which typically most science in the Western traditionally, classically have followed. So thereby, there's body is broken down into body systems, which is broken down into organs, broken down into tissues, it's broken down into cells are further broken down into the subparts of the cell, the parts that make the cell, and everything is studied individually. And which is why this entire setup of very targeted pathways. So if I've understood how the cell is behaving in a certain way, I'll develop a single target molecule which is going to come and affect it, and I'm going to study it and make a drug out of it. It's a reductionist way of understanding the body. Even brain and thoughts are understood as electrical impulses, electrical connections, neurosynaptic connections, and things of that sort. Certain things like psychosomatic disorders, certain hormonal changes, autoimmune disorders are still not completely understood because they may not have an entirely physical basis or a physical form in which it gets represented. Whereas Ayurveda um, understands the human, and I'll come to that a little later, that why Ayurveda is able to create a more wholesome understanding of the human body or the human individual, is because it does not only take into account the physical form. That's just sharir. That's just sharir. Then there are indriya. There's a bahya indriya that you're able to see, so your eyes, your skin, your tongue, and then there are antrik indriyas. So for each one of these indriyas, there is an internal indriya which is unseen. Because if I close my eyes, I can still visualize, right? If I still my favorite song and I start playing in my head, I can actually hear the music in my head, can't I? So there is a bahya indriya and then there is an antrik indriya. There is an internal indriya as well. Then that's the sthul sharir, the grosser form of the human body. Then there is the more sukshma sharir, which comprises of the ahamkara, the manas, the chitta, and eventually consciousness, the soul. Thereby, the concept of an individual is not just the physical body, the physical form, but understand it as body complex. So this whole thing put together, the body complex, is understood as what in Ayurveda is called a Chikitsa Purusha, the individual, the Chikitsa Purusha. The basic foundational principles are around Vata Pitta Kapha. The doctor in the morning was also, Dr. Ashwini was mentioning that basis Vata Pitta Kapha, they define all your physiological functioning of the body. They govern most important functions in the body, right from your blood flows to your digestion, to your metabolism, to your elimination, to the things that bind your organs together. Every function of the body is governed by one of these three gunas or energies, whatever you want to call them. And they are constituted from the Pancha Mahabhutas. So Agni, Akash, Jal, Prithvi. So the Pancha Mahabhutas combine together to form Vata, Pitta, Kapha. So it's a very organic, linked way of looking at the human body. This concept gives rise to Prakriti, what ma'am was saying. So thereby, at birth, all of us had a different composition of Vata, Pitta, Kapha. Somebody was predominantly Pitta, somebody was predominantly Vata, Pitta, and thereby each one of us are unique. Just like your thumbprint is unique, nobody's fingerprints match, nobody's retina matches. Everybody's got a unique print. Just like that, everybody's got a unique Prakriti. So while we may all look similar, have two eyes, one nose, and all of that, may have, even to the extent that identical twins may have different Prakritis. So they're very different. Also, this body complex is not partitioned. ऐसा नहीं है कि शरीर जो है मन से बात नहीं कर रहा है, मन जो है वो इंद्रियों से बात नहीं करती है. This is all interconnected. And what connects all of them are the doshas, Vata, Pitta, Kapha. There are dhatus, the 7 dhatus in the body, right from rasa, rakta, mas, majja, asti. 7 such dhatus. There are strotasas defined. Strotas are channels through which things flow in your body. There is Agni, 3 main kinds of Agnis which are subdivided into other sub forms. And there is Manas. What is beautiful is, one, you are completely unique at the level of Prakriti. And then the interplay happens. So 3 doshas into 7 dhatus, into 13 strotases, into 3 major kinds of Agnis. You multiply it. What kind of permutations come by? That's how the body interplays can happen. And disease manifestation, same disease, same symptom in you will be very different from him. So 2 patients with diabetes showcasing the same symptom, both having the same levels of elevated blood sugar levels, but their reasons and the pathogenesis of the diabetes may be very different, and thereby their treatment changes entirely. And that's the beauty of how Ayurveda looks at it. Also, I don't want to get into that too much detail, is the Sthul Sharir and the Sukshma Sharir. That's another beautiful concept that Ayurveda has. So the concept of health in Ayurveda, what is health? स्वस्थ क्या है? मेरे में एनर्जी अच्छी है, मेरी मसल स्ट्रांग है, मैं चुस्ती फुर्ती में रहता हूँ. अबंडेंस ऑफ समथिंग नहीं, एब्सेंस ऑफ समथिंग, मेरे में कोई बीमारी नहीं है, आई हैव नो ailment of any kind. That's also not how Ayurveda defines health. It is neither the abundance of anything nor the absence of anything. It defines it as a word called sama, balance. So it says sama dosha, sama agnischa. So your dosha, your agni, malakriya, dhatu have to be balanced. And prasanna, chitta, man, indriya, atma, they have to be happy. That balance is defined as health. Because each one of you are unique. Each one of us is unique. My reference point of health is different from your reference point. अभी मान लीजिए आप रूम में वहां बैठे हैं, मैं यहाँ बैठा हूं ना, तो मेरा जीपीएस लोकेशन तो यहाँ का है, आपका जीपीएस लोकेशन वहां का है. हम बोल रहे हैं कि नहीं यार सब लोग एक जैसे ही हों. अगर 72 बीट्स पर मिनट है तो सबका 72 बीट्स पर मिनट होगा क्या? नहीं, इट्स नॉट नेसेसरी. There is Vata, Vataj Prakriti, which may have variable. There is Pittaj, which may have stronger. And there is Kafaj, which may have slower. And that's entirely normal. That's healthy for them. Because our reference points are different, what health means for you and me different. And that balance, respect to your reference point and my reference point, becomes health. Beautiful, right? Because your health and my health definitions can then change. इसलिए आयुर्वेद में कोई नुस्खा नहीं है कि ये ले लो ये सब पर अप्लाई करो आयोडेक्स मलिए काम पे चलिए वाला सिस्टम नहीं है दैट वन शू फिट्स एवरीबॉडी इट्स डिफरेंट फॉर एवरीबॉडी so thereby the concept of health is not some utopian dream ki today I am healthy tomorrow I am not. It's a very beautiful organic interconnected play where balance with my own self, my mind is peaceful, calm, happy. Also Ayurveda goes out and define my relationship with the society, the health of the society that I live in. If you live in a mohalla where there is always, and in some parts of Delhi it happens, there are so many cars on the road, you're perpetually frustrated because you can either get out or neither can you park your car. So by the fact of the space you're living in, that also has an effect on your health. The environment, the health of the planet, the environment healthiness that you're living in. If you're living in pollution, no matter how healthy you eat, what organic top-notch vegetables you eat, the minute you step out of your house, there is an AQI of 593. What are you breathing? And doesn't that affect your health? So it's a more macro understanding of Ayurveda. Also, why should you be healthy? There is also defined. Why healthy? Because there is a higher purpose to all of us. The higher purpose is attaining something larger. And in order to attain that something larger, I need to be healthy. In fact, not just with Ayurveda, it's my own learning. I'm not quoting it as a reference from anywhere. I was interested in economics, so I've done my MBA. And I've read Wealth of Nations from Adam Smith. And typically the purpose there is, how do you maximize the wealth of nations? How do you maximize shareholder wealth and value? That's the basic intent of economics coming from there. Thereby, it is maximize the profits, maximize the shareholder value. That's the intent with which you work. Thereby, you ignore certain elements, which is why today you see most problems that we have are an outcome of 200 years of doing that. Plastic waste, pollution, water bodies polluted, not adulterated food that we eat, chemicals in our food. Why do we have chemicals in our food? Because we thought more yield per acre, put this chemical, and thereby this maximizes the yield. And maximizes yield means maximum profits. But we didn't realize we were going to give poison to our kids in the process. And the point I was making was Arthashastra, so Kautilya Sutra, the Chanakya Sutra, when I read, the first sutra said, Sukhasya Moolam Dharma, Dharmasya Moolam Artha, Arthasya Moolam Rajyam. It's an economic treatise. Economic treatise starts with Sukh. Sukhasya Moolam, Sukh ka mool dharma hai. Dharmasya Moolam Artha. Dharm karne ke liye aapko chahiye. Even if I'm a father, I have a daughter, my dharma is to educate her. In order to educate her, I need earth. In order to manage that earth, you need Rajya. Economic enterprises, or in those times, they were nations. So, pura ka pura direction orientation alag hai. The purpose of writing the economic treatise was to help people make them happier, healthier, more balanced. So, to begin with, I will not do something that disturbs that balance. So today we talk about corporate social responsibility, which means do whatever you do. Whatever you do, make some profit, and part of that profit you give to some socially responsible cause. Whereas in the Vedic setup, the concept was not corporate social responsibility. It was a socially responsible corporate. That the entire purpose of the corporate is to create a larger good and not necessarily only maximize profit. इसलिए आपने घरों में देखा होगा दिवाली पे शुभ लाभ लिखते हैं. सिर्फ लाभ नहीं चाहिए, शुभ होना चाहिए, तब लक्ष्मी जी आएंगी. सो भारतीय परंपरा का ज्ञान है, ये फाउंडेशनली इसी दर्शन से निकला है. तो आयुर्वेद एक सांख्य, दूसरा वैशेषिका, ये दो दर्शन शास्त्र मोस्टली बेसिस रहे हैं. सांख्य डील्स विद द कॉस्मोस. तो आपने देखा होगा वो जो मैंने शरीर रचना दिखाया उस पुरुष प्रकृति है, तो इट डील्स विद द कॉस्मोस. बड़ा दुनिया कैसे बना, यू नो, परमात्मा कौन है, वो क्या तत्व है. एंड वैशेषिका इज द वैदिक इंडियन रिडक्शनिस्ट साइंस. कि ये जो नीम है इसका आयुर्वेद में बोलते हैं विपाक, पोस्ट डाइजेस्टिव इफेक्ट क्या है. इट्स रिटन. आमला, you typically the principle is that if it is bitter or sour, it aggravates pitta. ये एक प्रिंसिपल है. बट आमला इज एंटी पित्ता. व्हाई? क्योंकि इसका विपाक मधुर है. वंस यू ईटन आमला, व्हेन इट गोज डाउन, इट गेट्स डाइजेस्टेड, इट बिकम्स मधुर, मधुर रस, विपाक. हाउ डिड दे नो? दैट्स वैशेषिका. And because Ayurveda was able to combine this whole picture view and the reductionist system together in a health science, that's why it is a more complete science. उसमें आपने देखा होगा यत पिंडे तत ब्रह्मांडे यथा लोके तथा देहे. जो सब अंदर है वो सब ब्रह्मांड में है, और जो सब ब्रह्मांड में है वो आपके एक सेल में है, every cell. And that's because of beautiful combination of Sankhya with Vaisheshika. And they both come together. The rationale of the Vaisheshika with the wholeness, the wholesome, the largeness, the completeness of the Sankhya. So it makes it a more holistic science. उससे क्या फायदा है? तो हम क्या फायदा? How does it then differentiate in its approach? So between the current medical setup and the Ayurvedic view on health, how does that differ? Today's predominant medical setup is symptom driven. डायबिटीज हुआ तो हमारा गोल क्या रहता है? शुगर कंट्रोल में आना चाहिए, है ना. शुगर कंट्रोल करते हैं हम. अभी यहाँ पर आईआईटी खड़गपुर में साइकिल बहुत लोग चलाते हैं. तो एक लड़का आया, वो अगर आप एडवाइस दें, वो आता था, हवा भरता था, फिर जाता था, फिर अपना क्लास अटेंड किया, फिर दोबारा से हवा भरा, फिर आया, फिर यहाँ पर खाना खाया, फिर से हवा भरा, फिर गया. और रोज सुबह शाम यही करता है. सुबह हवा भरेगा, साइकिल ले जाएगा, शाम को फिर से भरेगा, वापस घर आएगा. रोज उसको क्या करना चाहिए? पंचर ठीक करना चाहिए ना. हम अपने हेल्थ के साथ क्या करें? बीपी हुआ तो एक गोली सुबह, एक गोली शाम. एंटासिड, एसिड हुआ, एंटासिड खाया, फिर चाय भी पी लिया, पकोड़ा भी खा लिया, समोसा भी खा लिया. डायबिटीज में हम शुगर कंट्रोल करने का टारगेट कर रहे हैं. बट डायबिटीज इज नॉट, शुगर बीइंग इंक्रीज्ड इज मियरली द मैनिफेस्टेशन. अभी गाड़ी है आपका, गाड़ी में पीछे काला धुआं आ रहा है, तो आपने फिल्टर लगा दिया वहां पर, माइक्रो फिल्टर, और आप, क्योंकि वो कार्बन रोकेगा, तो आप देखो मैंने ठीक कर दिया गाड़ी. प्रॉब्लम तो इंजन में था. आप डीजल के गाड़ी में, पेट्रोल के गाड़ी में डीजल डाल रहे हो यार. वहां पर हरियाणा में कई बारी ऑटो वाले डीजल के ऑटो में केरोसिन डाल के चलाते हैं. तो प्रॉब्लम तो वो है, आप कितना ही फिल्टर लगा लो, ये प्रॉब्लम ठीक नहीं होने वाला है. सो whereas it is a more symptom driven approach, we are trying to manage the symptom. Ayurveda takes a root cause based approach कि भैया छोड़ो, शुगर बढ़ रहा है वो तो पता है, बट क्यों बढ़ रहा है? दूध को आपने स्टोव पे रखा है, उसमें उबाल आया और फूंक मार दो तो वो नीचे जाएगा. दोबारा से उबाल आया, दोबारा फूंक मारो, नीचे जाएगा. बार बार होता रहेगा तो क्या होगा? हट जाएगा दूध, पनीर बन जाएगा, जो भी बन जाएगा. हेल्थ के साथ यही होता है. टैबलेट खाते रहेंगे, शुगर मैनेज, शुगर मैनेज, शुगर मैनेज, वन डे किडनी गॉन. बीपी मैनेज 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 मैनेज, वन डे हार्ट गॉन. We are focused on the symptom, not the root cause. Ayurveda takes a root cause based approach to disease management.
In the morning, Dr. Ram Manohar has clearly told that over glorification is not correct. Similarly, even I have an experience of 20 years in the modern field. We know I address that we control this thing. If you don't control the BP and sugar, the all the end organs like heart and kidney will go.
Of course.
Similarly, diabetes also there is no magic cure in the Ayurveda. So Ayurveda is also even allopathy or Ayurveda both are tamasic chikitsa. So essentially, you said about the 28 year, the life expectancy at the age of independence was 28 years in India. So now it is more than 72. As you rightly acknowledged, the modern medicine has played a role, but as the population ages, the diseases will pick up. So any population, usually less than 40 years, not much lifestyle disorders. So the addressing the in Ayurveda also stresses on there are the madam well knows there are Ashtanga niyamas, Yama niyama. So when they are doing all those things, then the Ayurvedic medicine will be of useful. Otherwise, if we just live a lifestyle like any other person, and if we want Ayurvedic medicine to act, it won't act.
Correct.
So I think the oversimplification is not good.
So let me clarify that when I'm saying. So what I'm saying is not that symptomatic management is not important. It's very important. Because if somebody is running a sugar levels of 350, 370, if you don't bring it down in the short term, it will have detrimental effects in the short term. However, merely following a symptomatic approach.
I agree, but I just want you to, since you are dogmatically telling that it addresses the root cause, I just want you to how it addresses the root cause.
Which is what I was explaining. So it understands where it started from. So the nidana is what you're saying, causative factors, is what started. So let's say, for example, diabetes comes in as the prameh type of disorder in Ayurveda, which when early stage is maybe a kafaj prameh. The Ayurvedic doctor will try and understand what samprapti, which is what doshas, dhatus, strotases got involved and why. Why is the nidan? So it could be possible, say for example, sedentary lifestyle, or the food that you're eating, or the kind of food that you're eating. That affects your dosha balance. That goes out of balance, which affects a certain dhatu or a certain strotas. When that happens, that triggers say the pancreas not working, functioning as much as they should, and or the cells not absorbing the sugar, glucose from the bloodstream as much as they should, and thereby it disrupts the ecosystem. Whereby just trying to keep the sugar levels low will be beneficial, but it will not remove the fundamental problem going on with the body.
No, those are all lifestyle diseases. It needs that's why the physical activity, the food, nutrition, and all those things has been emphasized in the allopathic medicine also equally.
Correct.
So the impression which you are giving is an Ayurvedic medicine will go and address the root cause.
Yes.
That will not happen. That is oversimplification. Even Ayurveda also, it needs a lifestyle modifications, and what we need is a physical stress and a mental peace.
That's for sure. I'm not denying that
Yeah.
those causative, so the nidan, they call it nidan parivarjan. The nidan has to go away. But the route that the disease has taken, and it may have manifested in a certain type, while that manifestation needs to be addressed, the underlying samprapti vigatan also needs to happen. Which means that if I am identifying, say, the pancreatic tissues need rejuvenation, and thereby that rejuvenation will help boost the production of insulin or whatever. That does help. So while your point taken in the sense that and I'll clarify, I'm not trying to say that symptomatic management is not important.
No,
it is very important.
It is not symptomatic management. If there are some 8 different groups of medicines, different act differently. Some increase the sensitivity of insulin
Correct.
in the periphery, like a activity. Okay,
Correct.
some increases the secretion of the insulin from the pancreas. Only thing, this is oversimplification of is not good for either side.
I understand your point, and I'm only oversimplifying it to the extent saying the larger approach that is followed. So the larger approach that is followed is to understand where it is coming from and also understand that root cause, and not merely only focus on the sugar levels, is what my point was. But yes, your point taken in the sense, what I'm not trying to say is that don't do symptomatic management, it's important, or not look at the lifestyle causative factors, which even modern medicine prescribes in many cases. It does. In case of diabetes, it for sure does. And I'll come to that part in my slide also, is where it is changing. It is changing in the sense that as we mature in terms of our understanding of lifestyle diseases, we are understanding how important behavioral changes are to make. Behavioral change was not such a big discussion, say about 20 years ago. Today, it is center stage in a lot of disease discussions, like, for example, diabetes. Even today, behavioral change with arthritis is not as much prevalent, right? And I'm saying behavioral change with respect to the food that you eat, the diet that you eat. Whereas Ayurveda will follow a very strong role of what diet, what lifestyle you need to follow for even arthritis management. So certainly certain diseases like diabetes, even modern medicine takes behavioral change into account very, very strongly and predominantly as the causative factor. The root cause is still what is, I feel, missing from the equation of what fundamentally body system needs to be boosted, improved, what strotus needs to be closed, what is clogged, in order to enable the body to come back and heal better. In fact, we can talk after the presentation. There are a lot of leading researches that are now coming to the general view that the body, in fact, has enough intelligence to self-heal, autocorrect. You only need to create the right environment inside so as to body's self-healing mechanism to come into play.
A living example here. I had diabetes, and that thing was my allopathic doctor was giving me wrong medicine so that this can perpetuate for a longer period. Then I happened to meet somebody in Jaipur, and they gave me other kind of medicine, and they gave me some insulin or something. And after that, there was no need for giving any insulin, and then body responded, and now I am no longer diabetic.
So one clarification I'd like to make is that we are not talking of either, because there is enough and enough malpractice on either sides of the sciences, right? We are talking of the science and not maybe malpractices in the science, because I am sure on the other side there are enough practitioners that don't practice this kind of Ayurveda that we are speaking of. And if you don't use the tool the way it is supposed to be used, I don't think it's the problem with the science. It's with the practice of the science. So,
But for the Ayurveda, there is nowadays a trend for personal coach. So with that, there is a reinforcement, timely medicine, and ahar vihar, which are.
So I think the difference and the fact that there is a very evolved system. So Pathya Apatya, which is the dietary restriction you're talking of, what to do, what not to do. Pathya Apatya is a very evolved system in Ayurveda.
I literature in medical anthropology and social anthropology that suggests that in both the fields of, even in other fields of medicine, there are people who are practicing diagnostics and working like that, and there are people in Ayurveda, in Unani and other forms where they are not. So there is a beautiful piece of work that has been produced in Delhi University and continued in Oxford, where social anthropology was done within by the Bengali of the Bengali doctors that you see in
Bengali
this.
Davakhana.
And it tells you a lot about whatever is happening in the practice.
Of
So
course.
saying it just like in the morning, we had very good sessions which bring Ayurveda very close to science.
And
And
in fact-
just disregarding the whole field discipline of diagnostics
Correct.
will not help the cause, because not just in medicine, in anthropology, in social anthropology, it is already established that practices are different for same field of medicine as well.
No, you're right. And that's why I'm saying that because the practice may be a malpractice, and I don't want to get in there because that we are not talking of what happens when the system is abused or misused. We are talking of the system itself, right? And I agree with you. That partly, and I mentioned this, the 100 years of especially dilution of Ayurveda practice has happened. It's a reality. People like Bengali Dawakhanas and roadside Hakims have contributed to not, they may or may not even be trained in Ayurveda. They probably have some knowledge of some herbs here and there, and that's how they're practicing. That's why I'm saying it creates confusion in the end user's mind, and it has to be addressed as a way forward for Ayurveda. We should say that this is Ayurveda, this is not Ayurveda. What is Ayurveda really? When I say, like even the next point, I'm saying predominantly. So behavioral change, for example, is a fundamental principle proponent within the Ayurvedic system of medicine. Is you will come in, you will know that it is not just about taking the medicine. It is about making a change in your lifestyle, making a change in the way you eat, what you eat. So I think given that framework of the foundational difference and how Ayurveda summarizes as a whole person approach of not just looking at the manifestation of what has gone wrong, but also the causative factors and the route that the disease has taken in manifesting. Both are important. Just to give an example, so Prameh has different types of Pramehs. Which type is this patient being, how did this disease come by into the patient, the samprapti, the pathogenesis, is very, very important to know, and it may change the entire line of the treatment. I may prescribe him very different medicines or drugs, significantly different medicines and drugs, basis how the disease has manifested. Given that framework, quickly I want to talk about then how does Ayurveda rendered in terms of its usage? Where can we use Ayurveda? Where can we apply Ayurveda? Where does Ayurveda get applied and how? So there is this shlok in Charak Samhita Sutra Sthan. This defines the purpose of Ayurveda. And in fact, it says, Prayojanam chasya swastasya swastha rakshanam aturasya vikar praschamanam cha, which says the objective of the treatise is to maintain the health of the healthy. And if there is an imbalance, to cure the disease. And interestingly, if hundreds and thousands of years ago, preventive was mentioned as a core objective of the body of work, it means there is a certain degree of maturity they've reached with that practice, that we're not only talking of disease handling, we're talking of preventive care, which is something which is now coming more and more in the purview as lifestyle disorders. So which means Ayurveda can be applied in both fashions. One, the swastasya swastha rakshanam part is the promotive, preventive part of Ayurveda, and it can be applied in those contexts, those settings. The aturasya vikar prashchamanam cha part is applied in disease management. So it is used in both the planes, both the aspects. This is the Shatkriya Kal. So the disease manifestation, the way it happens. So there is a 6-stage disease manifestation principle that Ayurveda mentions. The manifestation may only happen stage 5. But the samprapti beyond it, that starts with the dosh prakop and then a sanchay, that varies for the individuals differently. Their manifestation may be the same. It may manifest as hyperacidity in all in 3 people, but how it has evolved may be very different. And because how it has evolved is very different, the way I go about tackling it is also different. And thereby the samprapti vigatan aspect of how do I go to the root cause and address the root cause. And because it does mention such an elaborate way and mechanism of each disease and multiple pathways that each disease can follow, what does it mean in terms of its applications? And this is how I like to summarize and also to differentiate the different aspects of Ayurveda and the confusions that arise with Ayurveda, which we spoke of earlier. Clearly know there is one objective of treatment, that somebody is not well, they have a disease or a problem or a health condition, and we want to treat it, we want to address it. That's the treatment element of it. Then there is a larger circle around it, which is the circle of wellness or well being, which means I may not have a problem right now, I may have a minor issue, a minor ailment. How do I correct myself? And the third circle, which is a very, very well defined way of life. This is another something which is unique to Ayurveda as a body of knowledge. It has a certain prescribed way of life that it recommends. And that may, like yoga, sir, you were saying yama and niyama, certain things are universal suggestions made that everybody must follow. And then there are also personalized recommendations basis your prakriti, what kind of way of life you should lead, what kind of inclusions and exclusions you should have in your diet and lifestyle. So given that's the kind of framework in which Ayurveda can be applied, it can be applied to treatment, it can be applied to wellness and well-being, and it can also be applied to as a way of life. How do we look across the different ways in which we can interface with an individual? And what specific role Ayurveda can play? Also, just to mention, and this is interesting, is now there are very interesting applications apart from happening with plant and animal. Ayurveda ingredients and principles being applied in agriculture with animal health. So Ayurveda veterinary is a very relatively fairly new in the recent times, but a growing segment where same ingredients are being looked at in animal care or even plant care. Very nascent, very small plant health, but a very interesting application of Vriksha Ayurveda. Something that's mentioned in the texts as well. Also apply environment health and the ecosystem health. There is very little here, but in the context of the soil health, the health of the farming and agricultural ecosystem, so to say. So promotive health or disease prevention, so to say. The first element of health is even before you are born, is when you're conceived. So Garbha Sanskar in Ayurveda is a very beautifully described concept of how must a couple go about conception. How should they prepare their bodies? How should they prepare their own ecosystem to reproduce? And that's where the concept of preventive health starts in Ayurveda, even before you're born. It starts right at that level. So, Garbha Sanskar and Masanumasic. So, there is a regimented, during the pregnancy, month by month mention of how should the pregnancy be taken care of, and postnatal. What we are saying, every individual is unique, and Ayurveda has a very unique perspective to nutrition. Like how modern medicine, not modern medicine, but modern nutrition will look at it either in terms of the classical theory started with calories, and then it evolved to fats, carbs, proteins, and so on and so forth. Now there is a lot of research happening even in modern nutrition, and they're talking of the gut microbiome. They're talking of the gut health and how do you eat for the gut in that sense. So not necessarily linked to proteins and carbs, but what do you eat for your gut? And that's the more latest trending with modern nutrition. Ayurveda looks at it, one, from the Ras Gun Virya Vipak framework, which is a nutritional framework, food framework in Ayurveda, coupled with every individual's unique prakriti. So what is good for you may be healthy in itself, right? Say broccoli or gobi or what, say even ghia or tori. It may be good in itself, by itself, but may not be good for everybody in all contexts. So how do you apply food is a very area. And I think there is some work happening around it. The government is either already announced or about to announce something called Ayurveda Ahar, which is a broad framework for classifying food within the Ayurvedic framework. And I think it's a very interesting development which is happening. Another promotive health idea is introducing Ayurveda health concepts in schools. So, if it is introduced in school and that adoption of healthy habits happen, I remember when I was in school at that time, there were campaigns about, not throwing the paper out and not wasting paper and not throwing plastic out of the window. It has had a significant impression on me. And today, even if I think about throwing something out of the car window, a guilt creeps in from inside that something I'm doing which is not right. And if we're able to introduce these concepts in schools, we'll have children who would adopt. And a lot of the behavioral change that we're talking about, it's a habit. It's something we've been doing over and over again. We know our blood groups. We don't know what our prakritis are. So can every child know what his prakriti is in school and thereby continue to learn and explore the Ayurveda framework? Preventive care, and preventive both primary and secondary, in the sense that when there is some minor issue that has happened, how do you prevent it from becoming a problem, right? And secondary prevention, in the sense that when you say, for example, have a certain disorder, how do you prevent it from progressing and becoming something larger? So if it is, say, for example, diabetes, how does it not become into a retinopathy, or if the degeneration not go any further? And I think the Shatkriya Kal concept, which talks about specific way in which the disease is manifesting, is very important here for us to know, because thereby there can be an early detection even before it comes in as part of any sensor. Before anything else, you start feeling that now when I'm running up the stairs, I'm huffing and puffing a little bit. And you'll do a blood test, and blood test will come normal. Because by the time it starts showing in the blood markers, some amount of buildup needs to happen before it starts showing in the blood marker levels. How do we use the concept of Shatkriya Kal to promote preventive healthcare? I've put biomarkers and Nadi Vigyan in red because some work has happened there, which I will mention later in the presentation. But this is something which still needs to evolve on the Ayurveda side. How do you measure them? How do you understand them? How do you, like how today you can measure steps on your smartwatch, or you can measure your heart rate, you can measure your oxygen concentration. Can we measure some of these things through biomarkers and wearable technology? Applying the Dinacharya and Ritucharya concept, Ayurveda has a very, very well defined. Ayurveda says between the three things of the Desh, Kal, Bal, the Kal, with respect to what part of the day aggravates what dosha, is mentioned in the text. Also, Ritu, how does Ritucharya play a role in how you should adapt to the Ritucharya? In fact, there is a very interesting database analysis, which I will show you in the later part of the presentation, of how has that been a little bit understood through data. There was a Nobel Prize on circadian rhythm, if you're aware. Circadian rhythm, there was a Nobel Prize, I think it was a Japanese scientist, who's basically saying things which are mentioned as part of the Dinacharya. That you should eat early on, you should eat around sunset, you should be sleeping between 11 p.m. till 3 p.m. because that's deep tissue repair. That's deep tissue repair. Ayurveda mentions that as a Pittaj and Vataj Kal. Excessive Vata is responsible for degeneration. So the explanations may differ, but there is deep science, there is deep insight. We may not have enough data to talk about it, but it's interesting. So circadian rhythm is suddenly now becoming an important thing. And as the science is also understanding the importance of the biological clock, the biological rhythm, and so on and so forth, that's also getting adapted in the modern medicine. There is a lot happening right now in Ayurveda and advancements, be it in research, be it in documenting evidence for chronic lifestyle degenerative disease disorder management. Thankfully, insurance is also now available, offered for people who want to take Ayurvedic treatments. So it becomes more accessible to people. There are a lot of efforts going on in the integration of Ayurveda and modern medicine, because modern medicine has certain advantages and strengths for sure which are not deniable. The diagnostics that it brings, the emergency care, the acute care, the symptomatic care, that all of it brings into play. How do we take the strengths of Ayurveda, the strengths of modern medicine, and combine? The leading hospital chains right now are integrating, and some of them are typically Ayurveda as part of their offerings. Medanta is one of them. Apollo is another one. As part of their practice. We are doing a project with 7 MDs in Japan who are integrating alongside their modern medicine practice, Ayurveda. This is something interesting and a future looking forward. So obviously Ayurveda is all that, and I'm not saying Ayurveda has a long way to go with respect to still creating more data, still creating more evidence for the rest of the world to understand and look at Ayurveda as a medical evidence-based science. Some of the work that has taken place is doing data analytics, and this is something that Jiva has undertaken. The world's first big data analytics-based research paper was published, and Professor Sameer Brahmachari, who's the Director General, was the ex-Director General of CSIR, was a principal investigator on this paper. And some basic elements of what Ayurveda text says. So we say that as you age, Vata aggravates. In the Middle Ages, Pitta aggravates. With the big data analytics, that's the data is also coming back and showing those similar trends. Ayurveda says that skeleton and nervous are degenerative disorders, predominantly, mostly because of a Vataj imbalance, Vikriti imbalance. The patient data corresponded to that, and saying that 60% of patients had a Vikriti in an aggravated Vata for skeletal and nervous disorders. There are clinical decision support systems being built which further go on to collect more data, more evidence. So, making to the point that you were referring, there is an entire lack of such data available. Once that data is curated, yes, you are right, more clarity will come. What worked, what did not work, what worked in what scenarios. So, for a given problem, Ayurveda may be working in 2 steps, maybe in not the other 1 step. And if we're able to see that, we're able to make more pragmatic choices, make more integrative choices in those areas. So this was work done by us, so this was our patients, yes. So the entire, this study, there's a lack of time, so I'll probably take this offline. The entire study was done on some 3.75 lakh patient data set. However, each individual analysis was run on a subset, because 3.75 were all patients. If it is skeletal, it may have been, say, 75,000 patients for skeletal. But I'll take that question offline. I'll share more details with you. So Nadi analysis and diagnostics. There is a lot of work happening here also, digitizing, bringing in technology, bringing in data analytics, corroborating evidence back and forth. I'll just mention one such example. So Nadi Tarangani is one such innovation that's happening, which does Nadi analysis using a pressure sensor and a device. And they've done a lot of validation studies and so on and so forth. And what is interesting is this. Every Indian, my grandmother at least in my village, Sawan ke mahine mein people used to fast, right? We all know that during the rainy seasons, you kind of go a little slow and you eat a little less. They had an interesting data analysis on some 25,000 subjects. And during the rainy season, the basal Agni levels go down. Very interesting, right? This is a data way of proving it. One is me saying it. Now, a lower Agni will mean suddenly a change that needs to happen. And this is at a population level. At an individual level, it may differ. Somebody's may go down more, somebody's may not go down, somebody may go down less. And how do we build this data analytics and bring it for what should you change now in your food? And it is not just a general principle of a calorie-based diet or a protein-carb mixed diet. This changes basis how your Agni is shaping as you are going along. This was another very interesting analysis that came out from the patients. Was red line is the Agni here, if you see, right? So every 15 days, Agni kind of takes a dip. And it mostly is down during the Ekadashi time. And I'm not making any conclusions here because this is still very early and this is still fairly nascent. But there is science behind it. We probably are in a phase where we are collecting all of this evidence and finding a vocabulary which we understand as science, but very interesting. There is Ayurgenomics happening. There is a lab within CSIR, a project called Trisutra. They've been now working for many, many years, and they're bringing together modern genetics with an Ayurvedic principle understanding of Vata, Pitta, Kapha. So how do you understand VPK, Vata, Pitta, Kapha from a genetic standpoint? This work has been going on for many, many years, and they've had some very interesting breakthroughs from there. And this needs to continue to evolve, and we need to question, and to also, sir, answer your question and address a little bit, is the practice part needs to be removed from the science part. Not everything may come out to be holy grail, but as you continue to do it, certain parts of the science will get more sharpened, will gain more clarity, and gain more scientific based backing behind it. And thereby, the Ayurvedic medical science becomes one application, the Ayurvedic health sciences becomes the second application, and Ayurveda as a life science becomes the third application, and you divide it like that. One is not overlapping with the other. And I believe Ayurveda coming together with modern medicine provides India with one of the most unique opportunities of presenting a unique healthcare model to the world, which, if combined together, not only means more affordable healthcare, more accessible healthcare, healthcare within your house, but also a more complete solution to health. I will not go into the more details as the time is less, but I believe that in the Amrit Kal, the Amrit Kalash can be Ayurveda to take the Bharatiya Gyan to the rest of the world. Thank you very much.